two.
Hey everyone, I'm Diana Ramirez, Harris County Administrator, and during May, we're recognizing Mental Health Awareness Month with some important insights. It's crucial to recognize the significance of mental health in our lives and communities, and there's no better time to do so than now. Did you know that Mental Health Awareness Month has been observed in May since 1949? It's a time to raise awareness about mental health issues, break the stigma surrounding them, and promote mental wellness for all. But awareness is just the first step. Harris County is taking concrete actions to support mental health initiatives through funds from the American Rescue Plan Act. These funds are being directed toward programs and services that prioritize mental health, substance use treatment, and overall well-being in our community. This month, we bring you a little insight into the Santa Maria, one of the numerous organizations that Harris County partners with to assist with outreach related to behavioral health. Take a look as Nadine Scamp, Chief Executive Officer of the Santa Maria, discusses the incredible work they're doing to support mental health and substance use recovery in Harris County. Mental health struggles and crises can affect anyone. If you find yourself struggling or in crisis, please call or text the National Suicide and Crisis Lifeline 988 or chat at 988lifeline.org. Thank you.
Hi, I'm Nadine Scamp. I'm the CEO for Santa Maria. So the mission of Santa Maria is to empower women and their families to lead healthy, successful, productive, and self-fulfilling lives. We provide a full continuum of services to meet each woman or family where they are on their recovery journey. So everything from community-based prevention programs and intervention services to the full range of substance use disorder treatment to longer-term housing and recovery support services. We are actually one of the only places in the state where a mom may bring her children with her while she accesses residential treatment. Santa Maria is considered one of the safety nets for this region for substance use disorder treatment. We are one of the only places where a woman without insurance can access treatment services. And so we provide that full range, everything from detox or withdrawal management, medication-assisted treatment services, residential and outpatient treatment, and longer-term housing and recovery support. So we're really there to provide access to everybody. We believe that everybody, no matter their background, deserves that opportunity to recover and thrive. The ARPA funding is federal funding that came along with the disaster relief with COVID. We found out about ARPA funding through both the contacts at Harris County as well as through our membership with the network of behavioral health providers. When we saw the opportunity to apply, it really aligned with one of our long-term goals, which was to provide an integrated clinic for women with substance use disorders and their families. We have been trying for a number of years to put this program together, and the ARPA funds provided us that opportunity to be able to start that program, launch it in partnership with Baylor College of Medicine, and be able to have those first couple of years of funding while we got established. Our iCare clinic, which is the integrated care clinic, is an integrated setting designed to provide pediatrics, primary care, behavioral health support, medication-assisted treatment, and recovery support services. And it also provides on-site recovery coaches, which are peer support mentors who are really out there helping with care coordination and those non-medical drivers of health. So they're helping with access to housing and transportation and those various things that we know really impact health outcomes that many of our families may not have that same opportunity to access. And so all of those are provided in the iCare clinic through ARPA support. Within the clinic setting, it is an integrated model, and so they are able to access pediatrics and primary care. So that's your wellness visits, your sore throat, being able to be tested for flu, and all of those things that come with having children in the house. But you're also able to access behavioral health support. So that is psychiatric services, counseling, the medication-assisted treatment, and then those recovery support services that come through the coach. And because we are providing a family-based model, we are also providing things like parenting coaching and family therapy, child therapy, really being able to touch that whole family wherever they are in the continuum and helping them to build those supports and that ability to interrelate and strengthen the family unit. We are truly grateful to Harris County for the ARPA funds. We would not have been able to launch this clinic without the support of the Harris County ARPA funds. And so that has made such a tremendous impact on what we're able to do. And then not only on the services that we're providing, but we're also using that clinic as workforce development. So in partnership with Baylor College of Medicine, we have residents, we have addiction psych fellows, we have social work master students from the University of Houston will really help training that next generation on what it means to work with families that maybe have limited income, that are struggling with substance use disorders, and helping to reduce that stigma and bias that we still unfortunately see in the medical community. Santa Maria has always been here for the community, and we have always grown in tandem with what the needs and desires of the community are. And so we have focused over the past several years really on building that integrated family support setting, and we anticipate continuing to do that. Unfortunately, there is such a need in our community for services, and there's many families that haven't been able to access the support that they need. And so we want to continue to grow so that we're able to serve the families who need that help. So I would say first, if you or a family member is struggling with a substance use disorder or another mental health challenge, don't be afraid to seek out help. People can and do recover each and every day. And we see so many people that are out in the community thriving in their recovery. They are integrated with their community. They are your neighbor. They are your sister. They are your mom. They're your coworker. And just know that there is that help and support available in the community so that you are able to recover and thrive.